Oh, that was wonderful. To hear from Cupid. Are you ready for AI? It's going to take over the world. Huh? It's my honor, really distinct honor, to present the next speaker for this session. But before I do that, I want to welcome my co-chair, and that's Dr. Taghreed. Oh, she's already here. Wonderful. All right, so it's my distinct honor to introduce to you the next speaker, who I think really does not need introduction. I was telling her that, she is it's really always an honor to have her at such an event. Her Excellency, Dr. Zainab Shinkafi-Bagudu, who is really currently the president-elect of the Union for International Cancer Control. She is such an accomplished woman. She really, if you want to talk about the powerhouse of oncology in Africa, you have to start with her. So in Nigeria, where she was the first lady, one of the states, she has been a champion for women's health. And she is one of the people who really thinks that, like Princess Dina mentioned earlier in the statistics, if you can prevent cancer, you can really save a lot of lives. And so her work is really at the forefront of screening and detection. And also, she's a founder of the Medicaid Cancer Foundation in Nigeria, where she's really been doing a lot of work that has shaped policy, transformed healthcare there, and now they are doing all the cervical cancer screening work in Nigeria. So what we'll talk about in this session is that beyond the clinic, there is policy and advocacy and political willpower. And there is no other person who can talk about this topic better than Her Excellency. Let's welcome her to the stage, please.
I have two problems here. One, it's after lunch. Two, you just had a very vibrant talk. So the odds are against me here, but good afternoon. And it's a pleasure to be here in Dubai at the launch of this very relevant and timely organization. Will introduce me. I wear different hats. So my talk is going to stride different parts of my experience and how we can really look at cancer care and equity, how the policies that we have can help us to improve cancer care across Africa, the Middle East, and the world generally. We've heard a lot. I'm not going to be too technical or go into areas that are not really mine. We heard from May earlier. She beautifully showed us a lot of information about where we are, particularly to do with radiation therapy and even diagnostics. And there is no doubt what we must all take back is that there is a gross inequity, and that inequity is why organizations like this keep coming up, and people like yourselves, the experts and the policymakers in the room, talking to each other. There have been good examples from the region, agencies or institutions that have tried to improve the quality of care and the standards. We heard earlier from Princess Dina about the King Hussein Cancer Center, but these things don't happen like that. Malaysia, it takes a lot of goodwill, and Pakistan, it takes a lot of political will funding, and the organization to get it going. But the gaps are there. The gaps are glaring, and it keeps on widening, particularly for those of us that live in the global south, that live in sub-Saharan Africa, that have seen the actual effects that cancer has on a woman, on her children, on the community, and on the overall well-being of the nation. You can see how cancer comes up. We saw some slides earlier. You can understand the science when they come to you, but for you to actually see what is happening to a family with, or a woman with cervical cancer, a woman that you walk into the room, a room, maybe it's on you, you can't have a room as big as this, but I promise you that there are cases that if one woman with cervical cancer, the types that I have seen, is sitting in this room, you will smell it from the door. And that is a vast inequity, but it is something that we see, we still see, and we still keep seeing. We talk a lot about advocacy and capacity building, but how are we using that capacity? How are we using the advocacy to actually translate into policy? Many of us advocates, we come to these meetings, we talk about our experiences, we share what we've seen, even the patient advocates now. But what is the effects that it has on the policy that your country is making? That is where we need to focus on, and that is where we need to ensure that we're training more capacity. There's so many aspects of cancer care. I'm not even going to go into all the aspects, but there are so many aspects that need capacity building. The healthcare workforce, the advocates that I mentioned now, if you're talking about the radiation oncologists, how about the medical physicists? In my country, we have less than 30. In a country of 230 million people, the few that we have are constantly going abroad. AI is wonderful, but I am a believer that the AI models that were being used now do not carry the data from the African subcontinent, from the African continent. And how much longer do we have to wait before we're going to be able to use AI as the game changer that it definitely is? The data is there. It's obvious. The evidence is clear that a lot of the models that are available today for radiation, for radiology, they don't have enough of the data from Africa. And why is that? Because we don't have the trials. We don't have, again, another slide from May showed us the dearth of paucity of clinical trials and research that is obvious in the African continent, as well as other low middle income countries. And these are all gaps that we need to change. So we must evolve from raising awareness. Many people think of advocacy as, oh, you go to, where I come from anyway, you go to a rural area with your nice posters, and you just talk to the women, you take your pictures, you put them on Instagram, and that's the end of the advocacy. But who has seen it? How has the minister, or not even the minister, let's step back a bit, the Cancer Control Deputy Director in the Ministry of Health, how has he seen it? How has it helped him to change anything or to implement further the plans that we have? So many beautiful plans, national cancer control plans. Yesterday in Nigeria, we launched a new one that is going to be implemented from 2026 to 2030. But we haven't finished the last one that we're supposed to be implementing, or we didn't implement it properly. So these are issues. We need to be able to speak more to power. There is political will in a lot of countries now. I travel a lot. My capacity has different capacities, and I get to meet so many different people in different countries. Cairo recently, we were in Cairo, and the political will that the country is showing is amazing. They're doing a lot in terms of cancer control where it has to do with breast cancer and cervical cancer, as well as liver cancer. But then it didn't just happen overnight. They've been training their capacity, the medical students, everybody is aware of what is going on. And then also the political will and the funding came. They won't tell me where their funding comes from, but they have a lot of funding to be able to achieve that. So we need to link and cross those T's, dot the I's and link what we're saying with the people that matter. I'm not sure that do we have any government people in this room that is actually holding a a government person from the Ministry of Health UAE? Nope. Do we have, I'm not sure what your legislature is like, but policy, who makes the laws in this country? Do we have any? This is not unusual. This is what we do. We gather ourselves in rooms and we speak to ourselves. We know these things, but where are the people that are going to write the laws, that are going to appropriate the funding that we need to screen these women, that we need to detect the cancer earlier? They're in their offices and we're not carrying them along. This is a critical part of advocacy that we have to write. Maybe, Prof, you need to look at bringing in others onto the board of the AMSTRO. As good as initiative it is, it's not going to really get there. We write the communiques and give to them, but they just put it somewhere at the bottom of their desks. Like Will was saying, I've been opportuned to have seen governance at a state level. And really, most of the leaders in the low-income countries, they have so many priorities. They are still thinking about how they're going to pay salaries at the end of the month, how they're going to stop the new sect that is attacking the village somewhere in their state, how they're going to feed food security. So when I take things like, oh, we need a CT scan in Kebbi State to my husband, he just looks at me like, how? Where are we going to find the funds? And you understand. So you're constantly looking for partnerships. And this is normal everywhere, whether you go to Kenya, in East Africa, maybe South Africa is a bit different, but any country you go to, the story is the same. The priorities are just so many that the healthcare system is greatly suffering. They have a budget. There is a budget, there is appropriation, but it's all paper, like most things in our country. The only way we can close this gap is through partnerships and ensuring that we have better financing structures. And that is where organizations like UICC, like AMSTRO, a lot of the ones we've heard about today can help by bringing to light the opportunities and the economic benefits to the country that we can gain from forming these partnerships. So it's really important that we speak to power and we strengthen our health system. I'd like to really congratulate you on this laudable venture of putting together the radiation oncologists and suggest a few ways in which maybe we can partner and look at what the outcomes can be. The strength of AMSTRO is that it's a regional body and you have access to so many experts in the region, and that's convening power as an institution and a body is really remarkable. So all of you have come together, you have an understanding of the knowledge of the culture and where you're operating in. Another thing I didn't mention was contextualizing our care, putting it into context and understanding that a lot of things that we do, we're doing for the people, we're doing for the patients. So it's of no use. I use this example so much and I need to change it. I will after this talk. There is no point trying to give HPV to a girl in a Muslim-dominated area, and you make flyers where the girl is wearing a hijab, and then you have a male nurse injecting her. That is not context, and that is not going to work. the greatest misinformation you have against vaccines is that you're trying to sterilize and reduce the population of young girls. So why will you take a male to vaccinate one of your young girls? It doesn't work. And this is something that I still see every day, not just in my country, but across in different places. So when you understand the context and you understand the sensitivities of the local people, you can make better decisions. And that is what one of the strengths that ASCO has. The UICC, as you all know, is a global organization spanning over 1,300 countries with over 170 members. Lots of programs, fellowships, supporting capacity building, advocacy, all the things I spoke about. You can learn online, you can come for physical courses. Convening power is massive. There are two major seminars, conferences that hold, the World Cancer Leaders Summit and the World Cancer Congress. For the first time, well, not the first time, there was one in South Africa, but in Sub-Saharan Africa, there's going to be in 2027, will be in Kenya. And so these are the kind of innovations and new developments that the UICC brings, as well as, the convening. We recently started the Cancer Planners Forum, and that has been an amazing success. So with that strength, those two strengths, we can really look more at expanding the fellowships that are being offered. We can look at how equity can be balanced better, or how we can even measure equity. We keep talking about equity, but what really is the gap? And how can we look at what is happening to the system in Norway or a Nordic country with a very high economic index compared to one of the countries in the Gulf region that are not so well to do. And of course, there are lots of financial accelerators that stand to be gained. So I hope I didn't overstay my time, no? And it's been a pleasure. I look forward to the effects, and we've seen what AMSTRO is able to achieve in future. I have no doubt that the future is really bright. I will be talking to our radiation oncologists. Our own association is called ACON, and there's also AOTIC, who I'm sure that Will would be very happy to link the rest of the members with, and a lot can really be achieved. I start my presidency in October, and I stand here humbly inviting you to partner with me to make it a success. Thank you for listening.
Thank you, Dr. Zainab, for this exemplary, informative and engaging talk. It definitely sheds light and opens our eyes to the struggles and hurdles African countries face in cancer control and care. It definitely also emphasizes the importance of international collaboration to fight cancer together. Dr. Wilfred, if you have any other comments.
Yeah, no, thank you so much, Your Excellency. I think one of the things that I really took out from that was, and I think, Nadim, you guys should really embrace, is the collaboration between UICC and AMSTRO. She starts her presidency in the fall, and the workforce is a big deal. So we want to take up on that partnership. Thank you so much. Thank you so much. Let's give her a hand again.
Probably if anybody has any quick questions.
Okay, with that, I'm going to hand over to, go ahead.
It's okay. Does anybody have any quick question from the audience? If not, we can move to the next session, and it's my pleasure to invite respected Dr. Mohammed Fahim to chair the next session.